Hello, everyone. Thank you for coming this event. And my name is Yunan Wu. I'm an assistant professor in UTD Mathematical Sciences. I obtained my statistical PhD in the University of Minnesota last summer. And my main research interest is causal inference in precision medicine and Mendelian randomization. And I also study some other topics in high-dimensional analysis and machine learning techniques. Today, I will introduce the causal inference in precision medicine in my research. So first, causal inference is the process where the causes are inferred from the data. It's widely studied in many research areas like medicine, psychology, and sociology. In causal inference, why we need it is that association doesn't imply the causal effects. And this is why we cannot use association, especially the linear association from the data to study the cause and effect relationships. For example, if we see the data, we will find that the drowning death is proportional to the consumption of ice creams. But we can never say the consumptions of ice creams lead to the drowning deaths because there is a confounder summer. In summer, people buy more ice creams, and in summer, the drowning death increases. And this is why we say we need the causal inference instead of the association. We call the summer as a confounder, that is a variable that have a causal relationship with both the treatment and the outcome we want to study. And to make causal inference, the key point is to control all the interventions, and the best way is to do randomizations. But we all know that randomization is always costly, and people don't often follow the assigned treatment in the experiments. And there are also some ethical reasons that blocks us to do randomizations. And this is why we need to study the causal inference in observational study. And my topics in causal inference includes the measured confounders, unmeasured confounders, mediation, and interferences. Here, interferences is correlated to some epidemic disease, such as flu and COVID-19. And I will introduce an important application in causal inference, that is precision medicine. In traditional medicine, the same treatment is always assigned to all the patients with the same disease. But we know that different people react differently to the same disease. Maybe a treatment is beneficial for most patients, but but it may have no effect on some of them. A small group of patients may be harmed by its adverse effects. So nowadays, doctors want to tailor the treatment by his or her characteristics to some disease. For example, they want to include the gender, age, clinical histories, and even the genetic information in the treatment selection. And this is why we want to study it in high-dimensional cases. And in precision medicine, the most important problem is to recommend a treatment to an individual based on his or her characteristics to achieve an optimal outcome. It means we need to estimate the optimal treatment regime, which maps from the support of covariance to the collection of treatments. And then we want to maximize the average outcome among the population. For example, HART is a medication to treat HIV infection. Doctors initiate treatments when CD4 cell count first drops below a certain threshold. So what we want to do is to estimate the optimal choice of this threshold based on given data. Although this is an example from medicine, we can also extend this study to many other areas. For example, it can be two two optional buttons in website design or two brands when we update the department laptops, or it can be two different movies when we recommend a movie. And even more, we can extend it to 3 or more treatments. And in my research area, what I want to do in precision medicine is first to estimate the optimal treatment regime that can achieve the largest average outcome among the population. And then I want to answer the question that which covariates are important in making the optimal treatment recommendations. So these two questions are the most important thing in my research area. So this is all my introduction. And do you have any questions?